Before we go over today's video, I wanted to add a disclaimer that this video is made to promote education around the medications Suboxone and Methadone. Therefore, please discuss with a healthcare provider or specialist before initiating either one as a treatment option. Methadone and Suboxone are the two most common medications used as opiate replacement therapies for people with opiate use disorders. Opiates may include but are not limited to morphine, oxycodone, hydromorphone, fentanyl, and heroin. According to Canadian provincial guidelines for treating opioid use disorders, Suboxone is recommended as the first-line therapy, meaning it is the first medical treatment a healthcare provider will most likely prescribe for someone living with opioid addiction. We will go over Suboxone first. Suboxone can be prescribed under the names Bunavail and Zubsolv. Suboxone's drug composition is buprenorphine combined with naloxone. Buprenorphine is a partial opioid agonist, meaning that it binds to the opioid receptors in the brain but activates them less strongly than full opioid agonists do. Naloxone is an opioid antagonist which works by blocking the activation of opioid receptors and preventing any opioid drug from producing its rewarding effects. Together, buprenorphine and naloxone work to reduce drug cravings and withdrawal symptoms without producing euphoria in a person with an opioid use disorder. Suboxone is available in a tablet or sublingual form, taken once or up to multiple times a day in smaller doses. Its effects last up to 24 to 36 hours. Side effects of taking Suboxone can include constipation, excessive sweating, dry mouth, changes in sex drive, drowsiness, lightheadedness, nausea and vomiting, and weight gain. Next, we will talk about Methadone. Methadone is produced under several trade names including Methadose, Metadol D, Methex, and many others. Methadone is a full opioid agonist, meaning it works by binding tightly onto the opioid receptors in the brain. It works like Suboxone by reducing drug cravings and withdrawal symptoms without producing euphoria in a person with an opioid use disorder. It is available as a tablet or oral solution that is generally taken once a day. Its effects last up to 24 to 36 hours. Side effects of taking Methadone can include flushing with a noticeable reddening of the face and neck, constipation, excessive sweating, dry mouth, changes in sex drive, drowsiness, lightheadedness, nausea and vomiting, weight gain, urine retention, and for some females, loss of menstrual cycle. So, how do Methadone and Suboxone differ? Methadone is taken as a drink, whereas Suboxone can be taken as a tablet orally or sublingually. Methadone may have more pronounced side effects and a higher risk of overdose due to being a full opioid agonist compared to Suboxone. Only physicians who have completed special training can prescribe Methadone, but any physician can prescribe Suboxone. Methadone is most commonly available through specialized treatment clinics, whereas Suboxone treatment may be easier to access. It could take weeks to reach a fully effective dose with Methadone, but only a few days with Suboxone. If you want to learn more and keep updated with new videos on our channel, then click on the subscribe button down below and follow. Thank you for taking the time to watch our content, and I hope this video was helpful.